Frontiers Health 2025 with Ann Mond Johnson, the CEO of the American Telemedicine Association. You just got off stage doing your keynote about globalizing digital health, right?
Mm-hmm.
Talk to me a little bit about sort of the key takeaways there.
Well, what I hope people got is that there are just a lot of positives associated with digital health and how it's tracking and how it's evolving. I think the biggest first takeaway is that it's an absolute essential, that you can't reach everyone we need to reach. We can't provide the services if we don't digitize. If you don't digitize, you don't scale. So there's a really important message as far as that goes. But there's some other things that we have to think about, the barriers. I mean, it's a pretty confounding world out there, and I use the example of mental health and digital mental health tools, and the fact that sometimes patients can't tell the difference between ChatGPT, digital health tools, and diagnostics, digital prescription therapeutics. So I think there's a lot that still needs to happen. And it's not just patients who are confused. In our world, we're very worried about regulators and legislators getting confused. And then they legislate in a reactive manner, not because they want to do harm, but they really want to protect their citizens. So it's well intended, but it's misplaced.
So ATA has been on the forefront of this for decades.
Mm-hmm.
You recently acquired the Digital Therapeutics Alliance. You've been becoming more actively involved in the digital space. Talk to me about sort of what the newest challenges are, and yeah. Right.
Well, we always said that telehealth was a much broader remit than just synchronous video. So it included asynchronous and video. And so working with digital therapeutics was a natural extension of what we do. And we think a lot of the things that we've experienced in the telehealth world is a harbinger of what's going to happen within digital health writ large. So very excited about joining forces with digital therapeutics. I think the big areas that we're going to focus on are those associated with regulations and legislation, and ultimately harmonizing those things so we don't have a patchwork quilt of laws to navigate. And also ensuring that we get reimbursed, that our practitioners get reimbursed for what they do.
You've got American in your name, but
Mm-hmm.
you're here talking about globalizing. You're
Mm-hmm.
here in Berlin. Why is it important that an organization like ATA be really focused on the global regulatory landscape?
Because together we are more likely to be successful, as opposed to having fractional, people advocating for their own specific self-interest. There is a common thread to all of this, and that's what we have to focus on if we're going to be successful. It's an inordinately complicated and expensive and long play to get through, to get good regulations, solid legislation. That needs a team. It's a team sport.
Excellent. Thanks so much for chatting with me, Ann.
Absolutely. It was a pleasure.